Most women can be encouraged to mobilise as soon as possible after delivery, but if bed rest is indicated, some exercises may help avoid circulatory and respiratory complications. Simple ankle and foot exercises, flexing and extending the ankles up and down for a minute or more at regular intervals during the day may help with blood flow. Until a woman is up and about, a few deep breaths in and out every hour that she is awake might help with respiratory function. Women should also be encouraged to practice pelvic floor muscle exercises, as described in my earlier video in this series. Abdominal exercises may also help with recovery, and further details are available via the websites indicated or other online sources. It's not uncommon for women to experience difficulty with bladder emptying in the immediate postpartum period. This is more likely to occur following an instrumental delivery or if there has been significant perineal trauma. But all women should have their urine output monitored to avoid the risk of urinary retention, which can lead to long-term bladder dysfunction. Evidence-based guidelines recommend that women should pass urine within 6 hours of giving birth. If unable to do so, then an adequate fluid intake should be encouraged, plus measures to try and facilitate urination. If these measures are unsuccessful, bladder fullness should be assessed and catheterization undertaken when necessary. Most, if not all, women will report some perineal and vulval discomfort or pain following a vaginal delivery, and this may be significant for some, particularly those who've torn, undergone episiotomy, or have substantial swelling or bruising in the area. Healthcare workers caring for women postpartum are advised to ask women about pain and observe the area if appropriate. If available, cold therapy, such as an ice pack, may ease pain and reduce swelling, but care must be taken to avoid further tissue damage. Oral analgesia may be indicated. Any infection, wound breakdown, inadequate repair or slow recovery should be addressed, and good perineal hygiene should be encouraged and facilitated. Approximately 90% of women who give birth vaginally experience some degree of perineal tearing, so it's very common and not necessarily problematic if the area is cared for appropriately in the postpartum period. A third or fourth degree tear, a tear that extends as far as the external anal sphincter or beyond, is far less common, but it still affects 5% or more of women having a vaginal birth and may be responsible for considerable short or long-term symptoms. Risk factors include first baby, an obstructed labour, prolonged pushing, a large baby, plus induction of labour and instrumental delivery. Following repair of the defect, adequate analgesia and antibiotics are indicated. To avoid potential damage of the repair site, dietary advice, including adequate fluid intake, is advised, and medication to ensure a soft stool. In addition to advice on good perineal hygiene, women should be encouraged to practice pelvic floor muscle exercises. It's understandable that some women might be reluctant to exercise muscles in the perineal area for fear of causing or increasing pain. They might also be worried that such exercises could cause further damage. However, there's no evidence to support this concern. Women can start pelvic floor muscle exercises as soon as possible. They may wish to contract the muscles gently at first, but can be reassured that the exercises should improve circulation of blood through the area, so promoting healing. They will also strengthen the muscles over time, reducing their risk of ongoing bladder or bowel dysfunction. Once women have been taught pelvic floor muscle exercises, they should be encouraged to practice them 3 times a day, approximately 8 contractions on each occasion. This will vary from woman to woman, as some will have very weak muscles initially, and they may manage only a few short squeezes. However, this should improve over time. To protect the area and help avoid or reduce any urinary symptoms, women can also contract the muscles with coughs, sneezes, lifting, etc., and if they experience a sudden urge to pass urine. To encourage good bladder emptying, they should relax as much as possible when passing urine. If using a toilet, they should sit down, allowing muscles in the area to relax adequately. Since a 3rd or 4th degree perineal tear extends into the anal sphincters, It's not surprising that some women experience bowel dysfunction, since it's these sphincters which are largely responsible for the prevention of leakage of stool. Research suggests that women who have suffered a sphincter injury during the birth of their first child are more than twice as likely to experience fecal incontinence than women who have not sustained such a tear. Women who do leak stool or just experience an urgent need to empty their bowels should practice pelvic floor muscle exercises. They should also contract the muscles when they feel the urgent need to pass a stool. This can reduce their risk of leaking. Some women may experience constipation, which might be because they experience pain or are scared that they might feel pain with defecation. As previously mentioned, this can be managed by drinking adequate amounts of water, eating a fibre-rich diet, and taking medication if necessary and available. Women may feel more confident if they support the area in front of their anus when trying to empty their bowels. They can hold a pad or some toilet paper over the area as they defecate. They should also be encouraged to take their time and avoid straining. In summary, most women should be well enough to mobilise soon after they've given birth and should be encouraged to do so. They should practice pelvic floor muscle exercises regularly. Some women will have voiding difficulties postpartum, and this should be addressed. Women should be advised on perineal care, and any problems in the area should be assessed and treated. A minority of women will experience a tear which affects their anal sphincters. They may experience associated bladder or bowel dysfunction, which should be treated appropriately.